begin with the foundational architecture of the human torso. Layered over this frame is the pectoralis major, a dense, fan-shaped muscle forming the primary bulk of the anterior chest wall. Its mechanical purpose is to bridge the gap between the upper limb and the central trunk of the body. This placement makes it the primary engine for generating force across the shoulder joint. This anatomical text defines it as a large, thick, fan-shaped, and powerful muscle. Within this single mass lies a multi-part lever system that requires deconstruction to understand. The muscle's standard actions include adduction, pulling the arm across the body, and medial rotation of the humerus. The biomechanics introduce a paradox. This same structure is responsible for pulling the arm forward and up, an action known as flexion. It can also execute the reverse motion, forcefully dragging a raised arm back down through extension. Mechanically, generating force vectors in these opposing directions should cause the muscle to work against its own integrity. The explanation lies in two specific structural traits highlighted here: the presence of two distinct heads and a physical twist in the muscle fibers before they insert into the bone. To see how these forces are managed, we must strip the anatomy back to the bone and rebuild the muscle from its separate skeletal origins. We return to the bare skeletal thorax to map these anchor points from the ground up. We start with the smaller of the two divisions, the clavicular head. The clavicular fibers anchor strictly along the medial half of the collarbone. Positioned below, the larger sternocostal head anchors to the anterior surface of the sternum, continuing outward across the superior 6 costal cartilages. This expansive perimeter of attachment creates the muscle's characteristic fan-like base. This vast anchor point provides the necessary stability to manipulate the heavy upper limb from the center of the torso. From this broad origin, the fibers must converge to reach a narrow target on the arm. That target is the lateral lip of the bicipital groove on the humerus. The clavicular fibers travel directly downward. The lower sternocostal fibers follow a different trajectory. The lowest sternocostal fibers sweep behind and upward, crossing beneath the descending clavicular fibers. This creates a two-layered U-shaped tendon known as an aponeurosis. Because of this specific twist, the fibers that originate the lowest on the chest actually attach to the highest point on the arm. This structural twist recalibrates the muscle's lines of pull, enabling independent force vectors across multiple planes. We can now calculate the muscle's actions by following the directional arrows created by these fibers. When all fibers fire together, they pull the humerus across the chest in adduction. Since the tendon inserts on the outer edge, this medial pull also forces the arm to rotate inward. Isolating the separate heads explains the paradox of flexion and extension. Because the clavicular head originates high and inserts lower, it pulls the arm forward and up into flexion. The sternocostal head performs the opposite role. If the arm is already raised, the upward twist of the lower fibers becomes critical. Their high attachment point allows them to exert force in a downward direction. Firing these fibers drags the raised arm back down, completing extension. As charted in this functional breakdown, the pectoralis major functions as two geometrically offset muscle bellies, each acting as an independent lever on the same bone. Shifting from movement to physical placement, the muscle serves as a primary anatomical boundary. It is located directly beneath the skin and the superficial fascia. Its mass acts as a protective roof for the pectoralis minor, the ribs, and the intercostal muscles. The inferior border of the muscle creates the anterior axillary fold, defining the front wall of the armpit. The neurological supply to this tissue follows its dual physical structure. Two nerves pierce the deep surface, the lateral pectoral nerve for the upper sections, and the medial pectoral nerve for the lower. Structurally, the pectoralis major organizes the geography of the anterior chest, setting the boundaries for the axilla and shielding the respiratory structures beneath. We can observe one final mechanical capability within this design. If the arm, the insertion point, is fixed and immobilized, the laws of leverage reverse. The arm becomes the anchor, allowing the muscle to pull on the chest. In this state, contraction pulls the ribs upward and outward. This makes the pectoralis major an accessory muscle of respiration, expanding the chest during severe respiratory distress. Deconstructing the pectoralis major reveals its logic as a multi-directional letter system. The combination of dual origins and a geometric aponeurotic twist allows it to generate opposing forces while maintaining its own structural integrity.